Hi, Dr. Berardi, and we had a question come in through the practice about what age is right for plastic surgery, and that has lots of answers, right? There's no age that's perfect for plastic surgery. It depends on the procedure you're getting. It depends on when you first started considering plastic surgery. When it comes to breast surgery, right? I had a woman today that wanted breast reduction, and she's in her 50s, and she says, "Am I too young to have breast reduction?" And the answer is no. If your breasts are bothering you, if they're too large and cumbersome, then you can have breast surgery, right? The breasts aren't going to change and all of a sudden become smaller through diet and exercise in a typical sense. So when it comes to breast surgery, typically any age is okay for breast surgery. It depends on when you have this desire to change your breasts. Tummy surgery, same thing. You know, laxity in the skin or loose skin is not going to change as you get older. So if you have it now and you have concern about it, then come to our practice. We can take a look at you and give you the best options. When it comes to facial surgery, that might be the only one where age is a factor, right? Why? Because typically or traditionally, older people may have the desire just because they're aging, right? So facelift, eyelid surgery, eyebrow surgery, right? These are all things that typically happen in an older population. People that come into my practice range in age from their 20s to their 80s, and we're doing all kinds of procedures: face, body, breast. Facial procedures typically maybe around the age of 50, people start considering facelifts, but I've had patients in their 40s that have had facelifts just because of genetics and they don't like their appearance. I've had patients in their 20s do brow lifts because of strictly their genetics. So it's a matter of something bothering you. Speak to a professional, right? Speak to a plastic surgeon. Come into my office and I can talk to you in depth about what your concern is, what the anatomic changes have been, and maybe there is a procedure for you. If I think that, well, not appropriate, come back in a few years, or maybe we have a less invasive procedure to help in a stepwise fashion to get you to a point where, okay, now you need surgery because our minimally invasive fixes are not going to work any further, then that would be a time to have surgery. So it truly depends on what you're interested in, what area of the body, what findings we see, but age is generally a factor in plastic surgery, only to the effect of what body part is it affecting and does it bother you now. So take care and have a great weekend.